We'd like to share a few visuals of our nursing simulation program here at Indiana University. We'll begin with our student simulationists program, students who help over 3 years with faculty with our simulations. In the middle is Lissa, one of our first student simulationists, Dana and Julie. These are our new sophomores who are beginning their online courses. They do pair up once they've taken the courses until they're comfortable with the high fidelity. They also attend faculty training. This is one on our pediatric high fidelity mannequin. This is Christina and Mallory. In their senior year, they do help out with the Southmore's first high fidelity simulation.
So what I'm going to do today is I'm going to explain to you how to go through the steps of your first high fidelity simulation.
Okay.
I'm going to give to you the S-bar, which is your report, how you're going to put your information down, as well as the doctor's orders.
Okay.
That you're going to be using
Sure.
for this particular patient.
Okay.
So this is for you.
Sure.
All right. Now I'm going to walk you through what we're doing. Okay.
Okay.
So the purpose of this simulation is you're going to do a focused assessment, and the focused assessment you're going to do is pain, abdomen, and respiratory. Okay. All right. So you're going to conduct the pain assessment, and then you're going to, based on those results, possibly give medication.
Okay.
Okay.
Sure.
All right. So here are the rules before simulation. Okay. So obviously the first thing you want to remember is confidentiality.
Okay.
You do not want to discuss what went on here,
Mhm.
what you saw, what you did to anybody else.
Okay.
Because then it's not fair for their
For them.
learning.
Sure.
Exactly.
Mhm.
And these are very vital skills that you're going to probably repeat at
As
the
a nurse, right.
Exactly, as well. So you want them to give them a fair chance to learn this. Okay.
Yep. No
All right.
problem.
Now, for today's purpose, you are a nurse. You are not a student. You are a nurse. You are
Okay.
a nurse, Anna. Okay. So by that, I want you to start thinking like a nurse, conducting yourself in a professional mannerism.
Sure.
Okay. All right. And I want you to talk to the mannequin and through the mannequin. What I mean by that is that she is a live person. Okay.
Okay.
So you ask her directions, you ask her questions, okay? You don't turn to me or anywhere, we're gonna be behind the mirror,
Okay.
but this is a live simulation exercise, okay? What I mean by talking through her is that if after I give a report and you didn't write something down, like say a history, you know what, Miss Watson, what was your history about this? You're talking through her. If
Okay.
she is confused, okay, like you're asking her questions and she's like, I don't understand what you're saying, oh, my head hurts. You know what, Ms. Watson, if I had a glucometer, I would check your sugar. Okay, so you're talking through her.
Okay.
Okay? All right. So another important thing is that I want you to think out loud, and that is called reflection and action.
Mhm.
By that, not only is it helping you with the
Mhm.
steps, but it's also helping us understand your thinking process so that
Okay.
when we're evaluating you
You can-
afterwards, exactly.
Okay,
That's key, not only here, but when you're out in real clinical.
Wrote that down. So if you don't mind, I would just like to take a listen to your lungs. Is that okay?
Yeah, that's fine.
So let's get you back up. Let's sit you up tonight and breathe. It'll help me listen to your lungs a little easier. It doesn't hurt when I sit you up, does it?
No.
Okay. So I'm gonna lean you forward just a little bit.
So, how do you feel in just like a couple words that then?
For the most part, I think it went fine. For the most part.
And then we'll do the plus delta. So, what do you feel you did very well?
I feel like I feel like I assessed the major things that was like probably priority as far as like her pain, seeing where that went to assessing her abdomen, because that was what she said her pain was coming from, and then her lung and respiratory sounds was the key things that I needed to check.
Okay. So if the patient, you're a man, so it's a little bit easier for you to lift them up. But say they couldn't, or you couldn't lift them up, and there wasn't anybody to help you. How could you assess the lungs on the back?
I could have laid her flat and rolled her to the side.
Is there any other ways? Say she couldn't roll. She was more comfortable sitting.
Just listen to them in the front.
You always want to listen on the back too, if possible. So the easiest way is just to take your stethoscope.
Oh, and just place it?
Yep, slide it right underneath of them.
Okay.
Okay? You can just push down on the mattress and then slide it under there.
Okay.
Okay? And then you can listen to your spots that you need to.
Okay.
What do you think you would have changed?
Maybe like my routine. It just, I don't know. I don't feel like it flowed like I wanted it to. I think I like the order I went in as far as asking her pain, checking her abdomen, and checking her rest. I think I like the order in which things went. I just like assessing the lungs. Like I really didn't know like how to really do that. So I was like gonna lift her up. Like what if I would have hurt her? So I didn't think about that.
Good.
First one
How do
done.
you feel? Yeah. How do you feel?
A little shaky,
Mhm.
but it was a little tough.
Okay.
Not gonna lie, it was a little tough, but
Did talking things out help?
yes.
Okay.
So we can leave it at that.
Honestly, you did very, very well. When you walked in, you knocked on the door, you opened the door, you asked for permission. That is like patient 101. That's how you build it, because it shows that you're respecting the patient.
Okay.
You introduced yourself, and you did the patient identifiers, which I really liked, and you checked it with the wristband on the right wrist. On top of it, the only thing I would have changed when it came to that, I would probably ask about the allergies
Okay.
for the medication, or a lot of times the allergies is like listed on
Okay.
their armbands, so that's just something to think about. You washed your hands, and then you kind of like told her your plan for the day, because a lot of times patients want to know, like, what are you going to do for this, blah, 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 and you did that. You know, you studied your things. You walked in, you're like, what's my vitals, what's going on? I want to make sure that my patient is stable. Then you went in, and you did the pain scale. You observed the GI, which was really good. You spent your time listening to all the quadrants, so that was very good in that sense. I like the fact that you thought of the respiratory, because that's what we were looking for too. The only things I would have changed is kind of like your technique for it, but we'll go over that.
Okay. Yeah, I didn't.
That's okay, and we're gonna go over that. And you did a very good job in noticing that she's not supposed to be on the nasal cannula. Instead, she's supposed to be on room air. And I like that
Yes.
you pointed out, because a lot of times.
The next few photos is of our simulation orientation. Sophomores in their first semesters do attend a 2-hour orientation in which they listen to a lecture, learn the terminology and guidelines, and also participate in a simulation. These are some photos of our debriefing. We have small group, large group, in simulation, and post-simulation. The next few videos of our student research project.
Speech has ordered a soft diet, and his breakfast meal tray is on the way up here. Tasks: feeding, bathing, oral care, getting him dressed for the day, positioning, ambulation, insertion of the indwelling catheter, and the IUN will take care of the care plan.
Do you have any questions on patient in bed 1? Okay. Patient in bed 2, they need a blood transfusion.
wait,
No, okay. Hey,
What are you doing?
Oh, yeah, sure. I'll have to call you back, okay? All right. Sorry.
Is there any medications for bed 1 that need to be away?
Brian, you're okay doing the catheter there, unless maybe, yeah, he's good with the male. He'd probably prefer a male.
No, actually, I really don't like doing those.
Well,
It's on a guy.
I'm sorry. You're gonna do it.
A bunch of questions. Feel free to answer any of them. You don't have to answer all of them. We'd like your participation. Thank you.
We, in capstone and med surg and stuff, the clinical that we have now, I mean, we do everything because we need to practice, and we're there with the nurse, and there's 2 of us, and we always just, knock it out, or practice or whatever. But we have CNAs and people floating around us all the time that we could technically delegate stuff to, but we never do because we're in school, So we don't have that mindset right now, but it at least makes us think that, okay, now there's a nursing assistant right there and he needs a cup of water, should I get it or should I keep passing meds and, learning that, so I mean, maybe I'll try to think a little bit more to utilize someone around me, because I mean, they're used to it, that's their job, and they shouldn't feel out of place, maybe, because my uniform's a little different, but,
That's a good point. Anyone else?
Do we lift him up now to see?
Press it right here.